Hello, my name is Debbie. I'm with Peak Ultrasounds 3D, 4D Mobile. This is Jessica from Southern Banks, baby.
Hi.
Jessica, just give us a little insight about what you do and how you got there.
So I am a nurse and a lactation consultant. I am private practice, so I have my own office. I'm not associated with a hospital or a doctor's office. Um, I've been in medical field since I was about 18 or 19 years old, which close to 40, so that's a good bit of long time. I started out with being a firefighter and an EMT. I did that for about 10 years before I went to nursing school, and then I just found my way to lactation. That's what I love to do. I'm a mom of two kids, and I enjoy having the flexibility that being my own person.
Yeah, I love that. That's quite a bit of a range of everything. I love
Yeah.
it. All right, so we got a couple questions from some of our moms to be, a lot of them first time moms. So today we're just going to talk about a little bit about lactation, and Jessica here will give us her insight. All right, first question. When is it normal for milk to come in?
So the average amount of time for your milk to come in is 3 to 5 days after delivery, but it can come in a little sooner, depending on if it's your first baby or not. Um, each additional pregnancy, your milk may come in sooner, and then it can come in a little bit later too, like up to around 2 weeks. Things that can delay milk coming in is, just extra stuff during labor, IV fluids, epidurals, Pitocin, C-sections. That can all delay it just a little bit, but normally not enough to really make that much of a difference.
Okay, well, I didn't know it could delay that with a C-section. That's
Yeah.
pretty cool information.
Yeah, especially if it's a scheduled C-section and you don't actually start the labor process.
Oh,
That can slow it down a little bit more.
okay, wow. All right, next question. So you kind of said it over, but can the milk letdown be different from baby to baby?
Yes, your milk can start coming in quicker, which with each subsequent child.
Okay, so it could help
Mm-hmm.
or be faster.
Yeah, and if you happen to have like low supply just from not having a lot of breast tissue with a previous child, if you really worked hard at trying to increase your supply, it may increase your breast tissue with each pregnancy.
Wow. Okay. All right. So a lot of moms, or at least first time moms, will have this question: is soreness and pain normal?
Yep, it's common. So when you first start breastfeeding, you can have some soreness. Soreness is normal, especially with that first initial latch for the first few weeks. When they first get on that nipple, it can be really sore for the first few sucks, the first few seconds, and then it should go away. Actual pain and getting nipple trauma, like bleeding, cracked, chapped, all of that in actual pain is not normal.
Okay.
You should see somebody to have that latch checked out with that baby.
Okay. All right. And next question. Can you explain to us what engorgement is?
So engorgement is when your milk is coming in and your breasts are just filling up with milk so fast and they're not being emptied fast enough. So this, again, it's a common but not normal occurrence. The things you can do to help prevent engorgement is feeding or pumping on a regular basis, like every 2 to 3 hours around the clock. That's going to help. Other things to do to help is taking some Motrin, resting, not over pumping. Latch as much as you can versus pumping. But if you're only pumping because baby won't latch, that's okay. Just don't overdo it.
Okay. So that was going to be my next question.
Yeah.
Tips. So you gave that. Thank you so much. Now, for all the first time moms, or even like myself, I didn't breastfeed my first baby, but I did with my second and third. Does it get easier, with time or?
It's different with every baby, but normally once you get through those first few weeks and you start getting a hang of everything, it gets a lot easier.
It does. Okay. So it gets easier, moms. Okay.
It does, but always if you're having problems, don't delay seeing somebody. Get
All right. What do we do if our baby is preferring one side over the other? Do we just stay on that side?
There can be a few different reasons why baby is preferring one side over the other. Sometimes if they have some oral ties, like a tongue tie, you hear about tongue ties a lot. sometimes that can create tightness and tension in their neck. And it could be as simple as needing to do a little bit of stretching and massaging
Okay.
in their neck. Sometimes, a lot of times, mom's nipples aren't the same shape or size. And baby can have a preference for which one works better in their mouth. And it's all about just figuring out why they're preferring the one side and then working with it.
Okay, wow, that's I had no clue. I'm learning a lot today. That's awesome. All right, and do you have any tips for pumping? How often, or should we at all?
So it depends. If you are wanting to latch your baby for every feed and they are latching well and they are drinking well, then there's really no need to pump as long as weight gain and diapers are good.
And that's if they're exclusively
Right.
breastfeeding.
Right, but not everybody likes to latch. Not every baby is good at latching, and you might have some problems. So it really just depends on what your situation is and what you want.
Okay. Now, for those moms that are pumping because they have to go back to work, leave baby at daycare with any relative, what are the best tips as to storing their breast milk?
Um, so breast milk can be out. Everything says 4 to 6 hours or 4 to 6 days in the refrigerator, 4 to 6 months in the freezer. I like to go by 5, 5, 5. 5 hours out at room air, 5 days in the refrigerator, 5 days in your freezer. Mind you, if you do have like one of those big, deep chest freezers that you're only going into it for storing milk, you can keep it for up to a year.
Okay, wow. All right. So when you say the 5, 5, 5, 5 room temperatures, that as once you pump, 5 hours out is okay.
Yep.
Now, what happens if they've had half the bottle?
After an hour of it being reheated out of the refrigerator or freezer, or after an hour of it touching their lips from the bottle, it needs to be tossed.
Okay, 1 hour. Okay, awesome. That is such a great insight about breastfeeding and all this. Thank you so much. Moms out there, if you guys have any questions about breastfeeding or lactation, anything at all, reach out here to Jessica. She's the best. She has so much knowledge. She's just a wonderful person. Thank you all for watching. Thank you for coming today.
Thanks
and
for listening.
you have a good day.